A migraine is a vascular headache, and it's believed to be caused by blood flow changes and certain chemical changes in the brain, leading to a cascade of events that include constriction of the arteries that supply the blood to the brain and the release of certain brain chemicals. Although there may be no vasodilation during the migraine attack, the vessels may dilate at time points well before the attack, and this can leave a series of signaling events within the vessels in its wake. To further complicate things, according to the vascular theory of migraine attacks are associated with intracranial and extracranial arterial dilation. A recent study using magnetic resonance angiography has suggested that slight dilation of the intracranial arteries may occur during the migraine attack. One study has found that the regular intake of magnesium reduced the frequency of migraine attacks by 41%. Although magnesium oxide was used in the study, it's cheap and it's poorly absorbed. For the best results, you should be taking magnesium bisglycinate. Start to slowly increase your dose until the side effects such as stomach discomfort or diarrhea are noticed. Then gradually reduce the dose until you've determined your maximum daily tolerable intake that doesn't cause any digestive disturbance. As magnesium is required by over 300 processes in the body, it can have profound benefits to the health after a few months of supplementation. Zinc supplementation had a beneficial effect on the frequency of migraine attacks. This is understandable, as like magnesium being required for over the 300 processes in the body, zinc is required by around 100 enzymatic processes. Therefore, one could assume that it would also have a synergistic beneficial effect when taken with the magnesium for a few months. With an overabundance of glutamate, we get a decrease in GABA, brain-derived nootropic factor and nerve growth factor. This excitotoxicity is thought to be responsible for seizures, migraines, dementia, anxiety, depression, and bipolar. Quercetin is a bioflavonoid and it's found in elderberry juice or grapefruit skin. This can help to increase the absorption of the zinc, vitamin C, and even shikimic acid. Coenzyme Q10 helps to convert nutrients such as fatty acids and carbohydrates into energy-producing adenosine triphosphate, or ATP. This helps to fuel the energy transfer within the cells. Scientists have found that people who experience migraine attacks have lower levels of some nutrients like coenzyme Q10, riboflavin, and magnesium. CoQ10 levels are often much lower in people who experience migraines. In multiple studies, coenzyme Q10 in the form of ubiquinol taken at 100 to 300 milligrams per day reduced the duration, the frequency, and the severity of migraines. In one study, 150 milligrams per day reduced the number of migraines by over 50% after 3 months. The powerful anti-aging substance that's extracted from red wine or Japanese knotweed, resveratrol, may be beneficial to your diet by facilitating the regulation of arterial tone. This can suppress the acute vasomotor changes that are associated with migraines and alleviate the symptoms. Typical doses are 500 to 1000 milligrams per day in the form of trans resveratrol. There's evidence that shows that curcumin, the concentrated turmeric extract, can help to reduce the frequency and the severity of migraine attacks. This benefit can be further enhanced when it's taken with a relative of turmeric, ginger. This can relieve pain from a number of conditions such as arthritis, gastric discomfort, and migraine headaches. Typical doses of curcumin range from 1 up to 5 grams per day, but due to its low bioavailability, its absorption needs to be enhanced by taking it with biopterin, which is a black pepper extract, or by taking it with a fat like butter, ghee, coconut oil, or fish oil. In an intervention study, a diet that was high in omega-3 was associated with 2 fewer headaches per month, and a diet high in omega-3 and low in omega-6 cut the monthly migraines by 4. Typical doses of omega-3 are 3 up to 9 grams per day of a molecularly distilled EPA-DHA fish oil blend. A migraine is a complex disease, and it's a consequence of an interaction between genetic, epigenetic, and environmental factors. The Mthfr gene polymorphism is one of the few replicated genetic risk factors for the migraine, and it encodes an enzyme that's crucial for the folate and the methionine cycle. Check out my video on the Mthfr polymorphism to learn how to determine if you're an under or an over methylator, and then you can see what supplements you need to help to control this condition. Sleep, mood, and headaches are all controlled by common regions of the brain. They all use similar chemical brain messengers, so there's no coincidence that sleep problems can trigger migraines. Also, when you don't get enough sleep, your pain threshold gets lower. This means you're more sensitive to things that hurt, including a migraine attack. Anything that keeps you from getting 7 to 8 hours of uninterrupted sleep each night could be a migraine trigger. You can check out my video on herbs to help you sleep and my video on melatonin for more information about this. A study published in the journal Headache found that patients with chronic migraines had abnormally low levels of melatonin byproducts in their urine. This supports earlier research that's linked low melatonin to migraines. It suggests that taking melatonin supplements can help to prevent or to treat migraines. L-Tryptophan is an amino acid, and it acts as a precursor for serotonin and melatonin. For chronic pain or for migraines, take 2 to 4 grams per day in divided doses. According to the American Headache Society, about 4 out of 5 people with migraines report stress as a trigger. Relaxation following a period of high stress has also been identified as a possible migraine trigger. During stress, cortisol increases, and during the relaxing phase that follows, the cortisol level drops. This fluctuation can trigger the migraine. The herb tulsi, also known as holy basil, can be taken as a tea to help to control the cortisol. The supplement Phosphatidylserine, when taken at doses of 600 to 800 milligrams per day, is also effective at controlling the cortisol stress hormone, but this is an expensive supplement. For your body to produce cortisol, pregnenolone is needed. Look into the pregnenolone steal, where constant stress over a long period of time can use up your pregnenolone store, and this can then lead to deficiencies in the anti-aging hormones DHEA and the sex hormones estrogen and testosterone. For this reason, many people take the pro-hormone supplement pregnenolone to help to reduce the chronic effects of stress and also for its anti-aging potential. In recent years, more research seems to be focusing on the fact that inflammation may indeed play a major role in the onset of migraine headaches. There's evidence that shows taking anti-inflammatory medications or eating an anti-inflammatory diet can actually reduce the number of migraines that you experience. Check out my videos on antioxidants, on inflammation, and on autoimmune disease for lots of diet and supplement advice. This is because a lack of antioxidants can cause chronic inflammation, and this can lead to autoimmune diseases. One reason for this could be if you're overweight, as there's a high demand for antioxidants to neutralize the excess free radicals that are created when you consume more calories than your body is normally meant to process. People who are overweight should be consuming strong antioxidants daily, such as 12 milligrams of astaxanthin, with a natural source of mixed tocopherol vitamin E and 1000 milligrams of vitamin C. Vinpocetine is an alkaloid derived from the compound vincamine, which comes from the periwinkle plant. Vinpocetine is often employed to lower inflammation and oxidative stress, both of which can alleviate migraines. More importantly, vinpocetine is well known for increasing blood flow in the brain. This supplement is often taken to improve memory and focus. Current literature shows that vitamin D can be beneficial for people who are suffering from headaches, especially migraines, to reduce the frequency of these. You get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Riboflavin plays an important role in cellular energy production. Its role in the mitochondrial energy metabolism suggests that it can be effective for the migraines. From the evidence available, it's well tolerated and potentially effective as a preventative treatment. For the migraine headaches, the most common dose of riboflavin is 400 milligrams daily for at least 3 months. Vitamin B6 pyridoxine is critical for nerve function, and a deficiency can result in psychiatric disorders, seizures, migraines, chronic pain, and mood disorders like depression. Serotonin is thought to be an underlying neurotransmitter that's involved in the migraines, based on lower than normal level of serotonin, which increases during the attack. You can check out my video, Know Your Neurotransmitter, Serotonin, for information on ways to help naturally balance this. Another neurotransmitter that's in a relationship with serotonin is dopamine. The herb Vitex agnus castus, or the chasteberry, is a dopaminergic herb, and it can improve motivation, focus, and sex drive, and it can also help some migraine sufferers. In a 3-month study of 100 women with PMS and migraines, the chasteberry treatment reduced the frequency of the monthly migraines by more than 50% in 42% of the patients. In addition, 57% of the patients who were given chasteberry had more than a 50% lower frequency of monthly days with headaches. Some of the other options are the herbs feverfew, butterbur, peppermint, willow, ginger, valerian, and coriander seed. A 2018 crossover study published in Neurological Science found that chamomile gel was able to reduce migraine pain. The herb guatacola protects your brain from toxins and oxidative stress. Studies show that it helps to protect against heavy metal and food additives which cause brain fog, mood swings, and migraines, and it reduces oxidative stress by reducing free radicals in the brain cells. Many report relief from the pain caused by migraines with CBD. You can check out my video on CBD and blood flow in the brain for more information. Lavender was also prescribed for the treatment of epilepsy and migraine attack. Interestingly, for my video on lavender as a replacement for Prozac and Valium, I discuss how it appears to work on a separate mechanism to the effect of the known neurotransmitter, and this makes it different from almost all of the other mood-altering herbs and drugs. Niacin supplementation is also associated with a decreased risk for age-related cognitive decline, memory loss, migraines, depression, motion sickness, insomnia, and even alcohol dependence. Picamilin is a chemical mix of GABA, the neurotransmitter, and niacin. Picamilin is often prescribed in Russia for the treatment of migraine headaches. A study published in Nutrition Journal reviewed clinical trials from the 90s up to 2004, and it looked at studies using niacin to treat migraines and other tension headaches. The conclusion from the review showed that niacin was effective for its vasodilatory properties in increasing the cerebral blood flow and its ability to improve the mitochondrial energy metabolism. The result is fewer migraines and less headaches when using this compound. Like L-theanine, the picamilin helps to raise GABA levels, but it also has the extra benefit of the niacin to increase the blood circulation in the brain. Low levels of GABA and poor cerebral circulation are associated with a variety of health problems. Anxiety increases, so does panic attacks, stress, and insomnia. Muscle spasms, hypertension, convulsion, Tourette syndrome, and epilepsy all increase in risk. Neurotransmitter levels decline. ATP energy levels decline, starving the mitochondria in the brain cells. When your neurotransmitters, including GABA, are in balance, you feel motivated, productive, and energetic, and you feel calm and relaxed during downtime. When GABA levels are low, you feel filled with dread, you're constantly worried, you've racing thoughts, and you're frequently late and disorganized. Many people in this GABA slump resort to high carbohydrate food or drugs and alcohol to help relax. This is where picamilin can have massive improvements on your life. Vitamin C can also be used as a scavenger of reactive oxygen species for treating neurogenic inflammation in migraine patients. Check out my video on making liposomal vitamin C cheaply at home. This process can also be used to increase the absorption of some other migraine treatments, such as resveratrol, curcumin, and glutathione. Serrapeptase is a chemical taken from the silkworm. It's a commonly used drug in Japan and Europe. In the US, serrapeptase is classified as a dietary supplement. Serrapeptase is used for painful conditions, including back pain, osteoarthritis, rheumatoid arthritis, osteoporosis, fibromyalgia, carpal tunnel syndrome, migraine headache, and tension headache. It's also used for conditions that involve pain and swelling, or inflammation, including sinusitis, laryngitis, sore throat, ear infections, swelling after surgery, swelling of a vein with the formation of a blood clot, inflammatory bowel disease, including ulcerative colitis and Crohn's disease. Some people use serrapeptase for heart disease and for hardening of the arteries. Regular exercise can reduce the frequency and the intensity of headaches and migraines. When one exercises, the body releases endorphins, which are the body's natural painkillers. Exercise reduces the stress and it helps the individuals to sleep at night. Stress and inadequate sleep are two migraine triggers. An example of reactive hypoglycemia is when you eat simple sugars, such as white sugar. This raises the blood sugar fast, and then insulin overproduces, and this causes a rapid decline in blood sugar. Both types of hypoglycemia can result in headaches and migraines. Low blood sugar may cause a general headache or even a migraine. A low glycemic index diet or a low GI diet would be recommended. You can check out my videos on type 1 and type 2 diabetes for ways to improve your blood sugar levels naturally with supplements. Glutathione levels were significantly reduced in migraine patients. The best form would be S-acetylglutathione taken at 200 mg once to twice per day, with its precursor being 200 micrograms of selenium once per day, and N-acetylcysteine taken at 500 mg 3 times per day. Check out my video on glutathione for more information on the body's most powerful antioxidant. Black pepper is the most widely used spice in the world. Long before scientific research explained how it worked, black pepper was used as a folk medicine to treat a variety of conditions and diseases, including rheumatism, influenza, muscle spasms, chills, fevers, migraines, and digestive problems. It was also used to enhance blood circulation and to stimulate the appetite. A 10 mg bioperin capsule taken 3 times per day can not only help with your migraines, but it can also enhance the absorption of your other supplements such as curcumin. For anybody with low thyroid function or hypothyroidism, the link with migraines seems to be a bidirectional relationship, meaning that either can increase the risk of the other condition. Both obesity and high blood pressure seem to increase the risk of episodic and chronic migraine. Check out my videos on hypothyroidism for more information. One interesting part of the treatment of hypothyroidism is taking nascent iodine, and this is needed by the body to produce its sex and its stress hormones, and as I showed earlier, increased stress increases the migraine risk. For more information about the herbs or supplements mentioned in this presentation, check out my website.